This is the second case of H5 influenza in a human reported in the United States this year. In Michigan, our public health system, in partnership with our local health departments, has a very robust symptom monitoring process. And so we've been working very closely in a collaborative way with farm owners, farm workers, our colleagues in agriculture to make sure that we are monitoring for even the mildest symptoms in folks who are working on impacted farms. And as a result, we've been able to test 35 individuals who developed some sort of symptoms, and now we have had one individual test positive. So we're doing symptom monitoring, which means asking folks in a variety of ways, whether it's touching base with individuals directly on farms or sending those text messages. We're touching base to determine whether folks are having symptoms, and if they are experiencing symptoms, then we are offering testing. And testing can be a nasopharyngeal swab or a conjunctival swab. Our risk assessment and the risk assessment done by the CDC has not changed. The risk to the general public remains low. We know that with our current understanding of H5 influenza and H5 influenza, particularly in livestock, that there is the risk for sporadic human cases, and that's what we've seen at this time. What we have not seen is any sort of sustained human to human transmission, and that means that the risk to the general public is low. We have specific guidance for those who work on farms in terms of personal protective equipment and how to be safe, how to monitor for symptoms, what to do if they develop symptoms. And then, of course, we continue to advise people to just use common sense precautions, such as drinking pasteurized milk.
Jelajahi cara baru mendapatkan informasi. Download Metro TV Extend sekarang.